We're attempting to pick up on a conversation we started last week. It's a closer look at this new alternative to the Affordable Care Act introduced by a trio of Senate Republicans. The Patient Care Act has been proposed, but it's not formally been introduced. That means it hasn't been scored by our friends at the Congressional Budget Office, but we are learning more about how it would work. The Republican plan is billed as a package of reforms to reduce health care costs and increase access. And it does appear that it would reduce the cost to the government. But at least some of that would simply be shifted to those trying to buy insurance. So, for example, the Republican plan offers tax credits, but only up to those making 300% of the poverty line. For the current law, it's 400%. For the Republicans, the credits replace Medicaid eligibility as a way to expand coverage. And while it's unclear if the total number of insured would actually grow, the senior vice president of the Kaiser Family Foundation claims that, quote, because the tax credits in many cases are quite modest and there are no minimum requirements on insurance, the coverage they get might be very, very skimpy. Now, as for savings, the Republican proposal claims it can save more than $1 trillion over 10 years. But a big part of that comes from a plan that would force consumers to pay taxes on over a third of employer insurance contributions under the ACA. Those contributions are tax-free. Now, the Independent Institute found that the plan would translate to a $47 billion tax hike. Ask John McCain how that worked out. What's more, the Institute said it would hit households earning as little as $30,000. So with me now is one of the co-sponsors of the Patient Care Act, North Carolina Republican Senator Richard Burr, who has been working on health care issues for a long time. So, Senator, I appreciate you coming on this. Let's start with a couple of, is this essentially Wyden Bennett from back in 2007 that McCain, you know, and here's what I remember, the portion in order to pay for this, taxing health care plans. You know how politically toxic that was for John McCain in 2008. As unpopular as the mandate is to some, taxing a benefit is very unpopular to others.
In fact, Chuck, what we do to correct everybody out there is that we apply a tax for Cadillac plans. In other words, for a plan that meets 65% of the highest price plan in the marketplace, 35% of it would have tax consequences. That misses the majority of the American people. As a matter of fact, it mirrors the president's own proposal in the Affordable Care Act, which taxes Cadillac plans. So there's very little difference in how the president's plan
you're expanding the number of plans you would tax.
Well, I think if you look at the definition of 65% of the highest price plan in the market, what you'd find out is that the president touches about the same number of plans as we anticipate that we would touch. The difference is we devote the money to pay for the tax credit, which goes to that bottom most vulnerable marketplace. And Chuck, remember, what we're asking them to do is participate in a newly competitive market, not one that government has constructed, but one that the marketplace is driven by.
Well, and that is among the critiques of this plan, because heard from the quote from Kaiser there, the concern they have is that what this would then create is substandard plans again, that you would have, by expanding what you just said, having the market control it, you would have the lower plans, in order for them to offer it cheaply, be missing some benefits that some people believe they should have.
Well, I would suggest to you that people aren't going to buy plans that don't meet the needs for them individually.
Right now, they can't afford it. I mean, well, you know, in some cases, right?
Listen, Chuck, affordability is what we've tried to address in this by creating competitive markets. If you look at the health care today, you've had 6 million people dropped from health care under the Affordable Care Act. You've had 2 million people sign up. We're still at a 4 million deficit. And when you ask for the #1 reason that people aren't signing up, they tell you it's unaffordable for them. What we've tried to do is address affordability and to make it affordable and to provide and empower the patient so that they can choose. An individual hopefully would choose a plan that meets their age, their income, and their health condition. We certainly don't offer as rich a tax credit or as benefit as the president does, but we think in a competitive market we can offer a comparable mix of products and let individuals choose versus government set the rules.
And let me ask you about one potential loophole that some have questioned on this plan. It says your plan would, you say that people can't be denied for pre-existing conditions if they are continuously insured. But if for some reason their insurance lapsed, then all of a sudden they could get treated differently and those preconditions can get... How do you account for that? If somebody loses their job and they lose their insurance and then suddenly the precondition issue is back for them, how do you prevent that from impacting folks that, you know, because of life circumstances, they can't be continuously covered even for, say, a week?
Great question. One, we, in this, after enactment, offer an open enrollment period that anybody can enter, just like they had continuous coverage. So it doesn't discriminate in any way, shape, or form. For an individual that loses their job, therefore they lose their health care, they can opt to go under COBRA. They can opt for the mandate in the bill that says an insurer has to continue the care. We also go outside of that, and we allow small businesses to group together and pool their resources to have power in the marketplace to negotiate their markets. We also allow insurance commissioners in the states to choose to go across state lines. So there's so many options that come into play that don't exist under the Affordable Care Act. We think that would have a positive impact on the options that individuals have.
Now, let me ask you this on the getting full Republican support. You're asking them to sign on to something that's going to be characterized as a tax increase for some people. You and I both know the Republican Party and the word tax, that, you know, tax is a 4-letter word, even if it is technically a 3-letter word. How do you unite your party around your plan?
Well, Chuck, let me say, we haven't asked anybody to sign on because it's not a bill. It's an outline, and it's a draft outline. What we've done is to our colleagues and across the aisle and said is, if you've got suggestions, give us your good suggestions. You know, the president said he had a phone. Apparently he doesn't know how to use it because an hour or two after we introduced this a few weeks ago, Jay Carney came out and trashed it from first page to last page. So I'm not sure that they're interested in any new thoughts. We are interested in new thoughts. We solicited from healthcare providers, from professionals, from individuals who lost their insurance, and the number one thing that they came back with was make it affordable. That's what we've tried to do.
All right, I will leave it there. Republican Senator Richard Burr from North Carolina. Thank you for your